Good afternoon, everyone. We've got quite a few updates for everyone today. So to let you know where we're at in Tulsa County, today we reported an additional 361 Tulsa County residents testing positive for COVID-19. That brings us a cumulative total of 25,024 people positive since the pandemic started in March. Good news is that 21,744 of those have recovered. There are currently 3,052 confirmed active cases of COVID-19 in Tulsa County. Since our last press conference, and I hope this starts to resonate with people, 27 more Tulsa County residents have died with COVID-19, including 2 deaths reported today, both males over 65 years of age. That brings the total to 228 lives lost in our community since the pandemic started. And please, as always, keep those families in your thoughts and in your prayers. Since November 1st, there have been almost 2,500 new infections just for Tulsa County. We are at an all-time high for our 7-day rolling average at 267.3 cases per day. Our previous high was July 29th at 253.9 cases per day, meaning our case rates right now are worse than ever before. If daily case trends continue, we will reach 4% of all Tulsa County residents testing positive within the next 4 days. Our case rate per 100,000 population is an astounding 3,856.9 per 100,000 residents. The next highest case rate per 100,000 population for reportable disease in 2018 was community with a case rate of 895 per 100,000 population in Tulsa County. So there's a huge discrepancy between our next highest infectious disease and COVID-19. Tulsa County residents represent 17.85 of all cases within Oklahoma. In 2018, there were 1,080 flu-related hospitalizations within Tulsa County residents. This is a rate of 168 hospitalizations per 100,000 population here in Tulsa County. As of today, there have been 1,832 who have been hospitalized. This is a rate of 281 hospitalizations per 100,000 here in Tulsa County. As we are in flu season, and as always, we want to remind everyone that you can become infected with influenza and the virus that causes COVID-19. So I urge everyone 6 months and older in Tulsa County to receive a seasonal flu vaccine. If you are sick, or you think you may have been exposed, or just want to be tested, please call us or go to your physician, seek testing. There's no cost for COVID-19 testing offered by the Tulsa Health Department, and you can now schedule an appointment online. We have started to see a bit of an increase in the number of people seeking tests from THD, where our capacity and supplies remain strong at this time. In October, THD collected 1,758 specimens for COVID testing. The samples collected had an average of 16.18 positive for the month of October. Last week, we collected 487 samples for testing. We're still awaiting results for 6 of those specimens, but so far the percent positivity rate in our pods for November is at 20.3%. Again, I want to make sure you understand that this is a percent positivity rate for just testing done by Tulsa Health Department and does not reflect the positivity rate in the entire county. If you're awaiting test results because you've been exposed or experiencing symptoms of COVID-19, it's important to isolate yourself from others and do not attend work, school, or other activities in case you are positive. Follow public health recommendations for isolation and quarantine to limit spread. Tulsa Health Department zip code map is updated every Friday. The map was created to reflect daily active case rates per 100,000 residents. As of the last update on Friday, there's 1 zip code in green, 4 zip codes that are yellow, 28 zip codes that are orange, and 9 zip codes are red. You can view the map and the clear public health recommendations for each color on our website. As you recall, in March, there were a lot of unknowns about this virus. When we announced the first case in Tulsa County on March 6th, we told people the best way to avoid exposure was to avoid travel to infected parts of the globe. We know a lot more now about ways to prevent this virus. Masks and social distancing have clearly demonstrated their effectiveness as the best tools in our arsenal to prevent spread. After the year we've had, we all recognize the importance of the holiday season that we know is swiftly coming upon us. Unfortunately, COVID-19 epidemic is worsening, and small household gatherings are an important contributor to the rise of COVID-19 cases. Thanksgiving can still be a time of celebration, but it's going to look a little differently than usual. Traditional Thanksgiving activities like large indoor gatherings at home, packed shopping centers on Black Friday, crowded events like parades and sporting events, these are all higher risk activities that should be avoided to help prevent the spread of COVID-19. Travel increases the chance of getting and spreading the virus that causes COVID-19. Staying home is the best way to protect yourself and others. Celebrating virtually or with members of your household poses the lowest risk of spread. Yesterday was my father's 92nd birthday, and I got to call my father in Nebraska and tell him that I'm not coming home for Thanksgiving because I want to keep him safe. It's been a tough year for my family, like everyone else has experienced. So keeping safe is most important. Keeping our family members safe is even more important. We have more tips on our website this week to offer suggestions to make the holiday safer. All the efforts to decrease virus transmission and protect our residents is vital to protect the health and safety of our residents. It takes everyone in our community doing their part to keep our community safe. I'm encouraged by the recent news this week about progress in the development of a COVID vaccine. The Oklahoma State Department of Health and numerous state and local partners on the development of a comprehensive plan for the distribution of vaccine in our community. The distribution plan has to be very fluid as there are many unknowns in what lies ahead. We can reasonably anticipate a very limited number of doses arriving initially, and they will be distributed according to Oklahoma's tiered system, which outlines priority populations. We must protect those who protect us, and priority groups in phase one include healthcare workers and public health staff who are expected to be working in settings where risk of transmission is high, who themselves are unable to avoid exposure to the virus, and who play a critical role in ensuring that those with or suspected of COVID-19 are able to be served by the public health system. It also includes residents of nursing homes, assisted and long-term care facilities. As the supply and availability of vaccine increases, the plan expands into additional phases and priority populations. The U.S. vaccine safety system ensures that all vaccines are as safe as possible. Safety is a top priority at the federal level, at the state and local level as well. Stopping a pandemic requires all the tools available. Vaccines work with your immune system, so your body will be ready to fight the virus if you are exposed. Other steps like masks and social distancing help reduce your chance of being exposed to the virus, or more importantly, of spreading it to others. Together, COVID-19 vaccination and following public health recommendations to protect yourself and others will offer the best protection from being infected with COVID-19. Now, to speak to our local regional medical response system, I'd like to introduce Adam Paluca.
Thank you, Dr. Dart. As Dr. Dart said, my name is Adam Paluca. I am the Chief Public Affairs Officer for EMSA, but today I am speaking on behalf of the Regional Medical Response System. RMRS leads healthcare system preparedness planning efforts and coordinates health and medical response and recovery activities for the healthcare system in their jurisdiction. Right now we're in Region 7, which is Tulsa County. The RMRS works closely with system partners like hospitals, emergency management, public health authorities, and various response agencies. As I said, in Tulsa, EMSA sponsors RMRS Region 7, that is the whole of Tulsa County. Under the authority of the Oklahoma State Department of Health, the RMRS is responsible for the development and management of regional healthcare coalitions. In Region 7, RMRS is working with the Regional Healthcare Coalition in response to COVID-19. Each day since the pandemic began, RMRS has communicated with local hospitals and local leaders to coordinate response plans. It has reviewed and sent appropriate documentation to OSDH. It has worked to support healthcare facility response planning and the execution of those plans. And it has identified PPE shortages, and if any existed, they've worked to fill those needs. In short, RMRS is here in Tulsa County and other regions across the state to work behind the scenes to make sure we are never caught off guard and have the plans in place to take care of the patients in our region. As Dr. Dart said, it's more important than ever that we wear our masks and take the proper precautions in all that we do. Now I'd like to introduce Ascension St. John CEO and Ministry Market Executive, Jeff Nellen.
Thank you, Adam. Mayor Bynum, thank you for this invitation. Dr. Dart, thank you for the invitation. You know, the rising levels of COVID-19 cases across our community and our state is concerning. At this time, Ascension St. John is experiencing record level inpatient COVID-19 volumes across our own health system. However, we do want to assure the community that at this time, we have the capacity to treat all patients across our 6 hospitals, including those diagnosed with COVID-19. It's important for the public to understand that bed capacity is extremely fluid, and it can change hour to hour. Managing high patient capacity and bed capacity is not something new to our health system or to our health systems in this community. We want to reassure you that at this time, there is capacity to care for our community, but it is now more important than ever that we all do everything we can to help curb the spread of this virus. At all of our Ascension St. John hospitals, clinics, urgent care sites across northeastern Oklahoma, we've put the plans in place and we're prepared to adapt to the healthcare demands of our community on a real-time basis. While all our sites of care are prepared, the rate at which this virus is spreading in the community is concerning. The doctors, the nurses, the support team, and staff at Ascension St. John are giving everything they can to care for the needs of our community. And as we enter the 9th month of this pandemic, we're humbled by the dedication, the compassion, the innovation that we've all witnessed from our associates, our caregivers, our physicians, who are all on the front line each and every day. And in order to protect our frontline healthcare workers, our essential staff, our first responders, we as a community need to continue to come together to use every mitigation tool possible to halt the spread of this virus. Fortunately, we do have the power to turn things around. Ascension St. John stands with the Tulsa City County Health Department, with the City of Tulsa, and with Tulsa County in all of their efforts to educate the public about the steps that we can take to keep our community safe. As a community, we must continue to take this pandemic seriously and do what we can to mitigate the spread. We understand the community may be experiencing pandemic fatigue, but as we head into the winter months, we need everyone to stay vigilant. We need you to continue to wash your hands, to wear a mask, to watch your distance, and as Dr. Dart talked about, get your flu shot. As the temperatures drop and as the holidays approach, remember that indoor gatherings can create a much greater risk for the transmission of COVID-19. Everyone in our community plays a crucial role in helping us all stay healthy and stay safe. It's only through everyone's continued cooperation that we can curb the high number of cases we're experiencing and protect our neighbors, our frontline workers, and hospital capacity. We're all in this together. And finally, now more than ever, it's important to ask your friends, your family, and your loved ones how they're doing. And remind each other, don't delay care. Schedule your regular appointments, your follow-up appointments, your specialist care, your procedures you may have postponed. Make sure you're getting your children vaccinated and that you're checking on older adults who might be managing chronic conditions. Also, when you talk about chronic conditions, it's important that you continue to keep your medications filled, your prescribed medications, and if you have trouble paying for that, talk with your doctor about that, or contact 211 for assistance. And finally, if you have an emergency, don't wait. Go to your nearest emergency room, your urgent care site. Our doctors, our nurses, our staff, we're ready for you when you need us, and that's what we do best. Thank you. And I'd like to introduce now from Ascension St. John, our Medical Director of Infection Control, Dr. Malik. Dr. Malik.
Thank you. Thank you, everyone. Thanks for letting me offer some comments. I'm the Director of Infection Prevention, Infectious Disease Consultant. I've been around for about a year and a half here. Enjoyed my work, loved the community, and this pandemic obviously suddenly elevated all of us into action. And as we all know, it has really burdened and strained a lot of our resources. I've personally seen about 500 patients. I've personally had about 11 or 1,200 visits with them. So I have deep, intimate knowledge of this disease. I've read about this disease more than any other disease in my entire life, and been part of clinical trials thanks to the Clinical Research Institute at Ascension St. John, which is an excellent resource for us. What I will say is that there's been concern raised about capacity recently, and all over the world, including early on in the pandemic in New York and other places like Italy, there was always resource constraints that would come up intermittently, strains that would come up on different elements of the care system, personnel, infrastructure, even policy ideas, testing supplies, reagents, medication. Everything has been under strain at one time or another. And so it's not surprising that in the face of this recent surge of infections that we've had some strain on bed capacity. But as has been communicated just recently by Mr. Nolan, there is not only the capacity it's not only a fluid situation in terms of capacity, but it's also possible to provide care by introducing new capacity. And we do have the staffing. There is no problem with PPE. All of our medications, that we have had no shortage of medications. Our testing reagent has hit a little bit of a snag, but should be restored. Supply should be restored shortly. We have the swabs, we have the machines, we have the platforms. They're all running. We also have the personnel. Recently hired several dozens of associates, and many of them have finished their orientation and training, so that's great. We have the physician capacity, the non-physician practitioner capacity, and most of all, we have the resource of commitment. I think that's sort of the biggest thing, and it's from that commitment that you get innovation, you get improvisation, you get those sort of things that will drive you to find new creative solutions. One of these solutions, for example, is repurposing certain spaces in the hospital, which we've done before, early on in the pandemic, to provide additional ICU capacity. And every hospital is capable of doing that. And people will stretch themselves and work extra shifts and do things of that nature. So I want to reassure the public that regardless of the strains that will come and go, and I don't want you to be alarmed, and I want you to have confidence that we will provide safe care, efficacious care, high quality care, effective care, and compassionate, humane care. That's the commitment that we all have in our organization. We constantly encourage each other because there is pandemic fatigue, but we will continue to fight. And there's some hope on the horizon with vaccines, antibodies, and so on. So we will prevail. But during this time, please don't be concerned about coming to the hospital if there is a legitimate need for it. There are protocols in place in the emergency room, at the urgent care sites, at the doctor's offices, to provide you with superior quality protection. In fact, I personally, walking around in the hospital for innumerable hours over the last 7 months, have felt safer in the hospital than out in the community. And that goes to reiterate the point that Mr. Nolan and others have made. Small or large congregations indoors are the primary way that this is spreading. I talk to every single patient I've seen, if they're capable of answering the question at that time, as to where they have been in the last 7 to 10 days that before we met and before they got ill. Invariably, it's either indoor dining, it's either attending a religious service of some kind, it's going to the gym, for example, it's having a family gathering. That's really where Because when you're with your family, you trust your family, you trust your friends, you don't mask, you're enjoying food and beverages, and that's when older people will come in contact with younger people. Younger people do not get terribly sick with this disease, and older people end up getting the infection, come to the emergency room, end up hospitalized, and unfortunately, we have continued to lose some of these individuals. And so that's why I think it's very important from a public health perspective, in addition to masking, in addition to watching your distance, and in addition to washing your hands and using an alcohol-based hand sanitizer and so on, I think it remains crucial that you try to create, if there's going to be any indoor gathering, you try to create physical separation between the older and vulnerable who have chronic health conditions from the individuals who are relatively young and healthy, and try to ventilate your space, even though it is cold. And I understand it's not easy to do that, but ventilation will be helpful in my view. All of the comments I'm making are my judgment, although they are mostly in alignment with the institutional position for the institution that I work for. But I am giving you my honest opinion based on what I've read, what I've seen, what I've contemplated, and I've thought about. So having said all of that, I think we're prepared. I think we continue to urge everybody to play a role. This is something that we all ought to take seriously because, like I said, even though a small fraction of us will get terribly sick, but when they do, it is a very, very difficult thing. It's something that really is difficult to pull people from in some instances. However, I will say that outcomes have improved. I've seen patients starting March or late February until now, outcomes are improving. We are able to prevent more patients from going to the ICU. There's a small number of patients that are requiring mechanical ventilation. There is hope on the horizon, but we cannot let up, and we have to continue to do our work. At the same time, you cannot miss your cancer screening. You cannot delay your cancer diagnosis and end up having a disease that you cannot control. You do not want to delay your cardiac care. You don't want to get a heart attack because you didn't go to the doctor because you were worried. There are protocols in place. People are taking extreme precautions in healthcare settings, and you will not. I doubt that there will be any risk to you at all. Thank you. And that's all I wanted to say, and happy to take any questions later. Thank you.
Hi, I'm Mayor G.T. Bynum. Don't have my glasses on, so just wanted to let everybody know who I am. In the last 24 hours, I've had the opportunity to visit with our hospital leadership here in Tulsa, leadership at the Tulsa Health Department, leadership at the State Department of Health, the governor's office, my colleagues on the city council, really talking about the situation that we find ourselves in here right now and what a path forward looks like. You've heard today, I think, some really important things for all of us to keep in mind. As has been mentioned, ICU bed capacity is a fluid target. I think more importantly, it's important for us to recognize that our healthcare system here in Tulsa is a regional system. It is not localized just in the city of Tulsa. We have several major healthcare systems that have facilities not just here in Tulsa, but throughout the region that have capacity and facilities and staff where they can carry out the surge plans that each of these hospitals has individually defined for themselves in preparation for just this kind of situation. So is there the ability to deal with the situation that we face right now on the hospital side? Absolutely. And you just heard that from the team at Ascension. I think it's really important, though, for us to not just think about this and talk about this from a death and capacity standpoint. And I'm as guilty of that as anybody else. We tend to focus so much on hospital capacity, so much on the number of deaths, and we don't always talk about the folks who have it and what that experience is like. And I spoke at our last one of these briefings about how I feel like one of the challenges that we face in people taking this seriously in our community, in overcoming this pandemic fatigue that's been referenced is that a lot of people don't know somebody personally who's had it still. It's still a new virus. You see examples, very thankfully, where the governor gets it and he's a healthy guy, he recovers quickly. You see the president get it, goes away, gets the best healthcare treatment that the world has to offer, recovers, comes back. Those are not necessarily typical situations that a typical Tulsan is going to get access to, though. And at the City of Tulsa, we're one of the largest employers here in our community. And over the last several weeks, I've had the opportunity to hear about the experience of our employees who have contracted this virus and what it's like for them and their families. You know, right now, just today, in quarantine, we have 46 non-sworn employees quarantined. We have 62 firefighters quarantined and 74 police officers. Let me tell you two stories from the last couple of weeks. We had one city employee who contracted COVID-19, had just shy of 106-degree fever, and got turned away from 2 hospitals because his respiratory function wasn't bad enough. Was given fluids and sent home with a 106-degree fever that was sustained. Another employee who was very ill with COVID-19 and could not get admitted to a hospital until he developed pneumonia. So that's the threshold that our community is facing right now as far as the capacity for our hospitals to be able to treat people. Your respiratory function has to be in danger of collapse. Less than that, discomfort, agony, you have to go home and treat it yourself. So I heard those stories and I thought about my family and my friends and the folks that I work with. And would I ever wish that experience upon them or their families? Would I ever want to be the person that was responsible for them getting it? I think I would rather get it myself than be the person who caused somebody that I care about to go through that experience. And yet we're still debating if people should wear masks or not in our region. Ridiculous. Last week, we honored and buried a great public servant in this community who was 40 years old. This wasn't somebody's grandfather. This was a young guy with kids, whose kids are going to grow up without their dad because of this virus. So this is not something that only old folks or only people with compromised immune systems are in danger of. This was a vibrant young man who is no longer with us because of this virus. So I know there's a lot of debate about whether or not people should wear masks or not. And it seems like in all the conversations I'm having, the alternative to what we're facing is that we can cut back on elective surgeries, as if that is better than people putting a little mask on. I'm so thankful in Tulsa that we have a city council that can see this for what it is and doesn't play the politics of it. I'm so thankful that we have a leader in Jenks, in Mayor Lee, who is putting this up for a vote tonight. My hope is that my colleagues in the region will follow his lead and do the similar thing, because I still can't find a good policy-based explanation for why we would not do this. I hear a lot about personal responsibility and freedom. I love personal responsibility and freedom. I spent months encouraging people to do this before we found that it was necessary to have an ordinance in place in Tulsa. Everything that we have an ordinance for, you should be doing on your own anyway. But ultimately, it has to be put into law. So I say that I think it's so important for all of us to think about this from the individual dimension. That's just 2 stories, 3, of people here in our community that have been afflicted with this virus. And you think about the families that have been impacted, not just them individually. The city council and I are doing everything that Dr. Dart or our hospitals have told us they need us to do here in Tulsa. The challenge for us According to the data that I saw today from the health department, since September, around 61% of COVID hospitalizations in Tulsa have been from cities without a mask order. 61.4% to be precise. In Tulsa, and I know there's a lot of folks that want us to do more things, to have a stronger mask ordinance, to limit events, to reduce restaurant operations. The challenge is those things are of decreasing ability to make an impact, again, when you have 61% of the people that are being hospitalized since September with this virus who aren't governed by the Tulsa City Council and I. They're from other communities. And so it has to be, as we talk about this as a regional healthcare system, it has to be a regional response to COVID-19. It can't be Tulsa all on its own. You can't fight this virus effectively by the Tulsa City Council and I trying to do everything by ourselves. So again, I'm so thankful for Mayor Lee having the courage, and I hope his colleagues share that tonight when they vote in Jinx on this ordinance, which very closely mirrors the one that we've had in Tulsa, which brought our numbers down when we put it in place several months ago. For everyone else in Tulsa, I would just ask you to think about the stories that I told a few minutes ago and think about, as you go through the holidays, if that's something that you want the people that you care about to experience. And if you don't, then think about what you can do individually to prevent that from happening. You can wear a mask, you can keep your distance, you can wash your hands, you can get a flu shot. These are all things that anyone in our community can do to slow the spread of this virus, to protect our health capacity, and most importantly, to protect our neighbors. A few things that the City Council and I are looking at moving forward. I had a visit with Dr. Dart today about our testing capacity locally, and in particular around rapid testing and what we might be able to do to increase the availability of that for our first responders and for our frontline hospitality workers in our restaurants all over the city. And that is something that he and his team are going to develop an overall cost estimate for the Tulsa City Council and I to consider and look at moving forward. We want to have a strong testing regime here in place in Tulsa. I'm very thankful for the support of the Rockefeller Foundation, who provided us a grant which is allowing rapid testing to be done for Tulsa Public Schools teachers through the Tulsa Health Department. We want to have a similar accessibility for our first responders that are out there in the community, keeping Tulsans safe, and we want it for those who are serving food and providing food to people throughout our community as well. So we'll be working on that in the weeks ahead with the Tulsa Health Department. At this point, I believe Michelle is going to open it up for questions and answers. Thank you.
One small change before we start media questions, so everyone at home can hear. We are going to have Dr. Dart. Any questions for Dr. Dart?
Dr. Dart, obviously, the Tulsans are extremely concerned. I'm sorry, Michelle just went over the rules. Obviously, Dr. Dart, Tulsans are extremely concerned. Appreciate you sharing about your own father, and I'm sorry that you aren't able to see him next month. I can't imagine how hard that is for you, or later this month. But walk us through a little bit. You were talking about the really high % positive rate, and we understand that that's only the Tulsa County Health Department numbers, but what do Tulsans need to understand about how quickly this is spreading through our community? Because it's not just community, but statewide. I mean, we saw 4,507 positive cases on Sunday in Oklahoma. So what do people really need to understand about how quickly this is spreading and how contagious it is?
And that's a really good question, because I'm not sure people really do understand how easily transmissible this virus is. And, you know, if we're going to get past this, we keep saying that we won't until we have a 2% positivity rate. We know our statewide positivity rate is hovering closer to 10% now. I just told you what ours was in our own pod. So our positivity rates means that the virus is transmitting effectively, efficiently, and much more than we need it to be. So that's why we keep talking about all the mitigation strategies to stop that transmission. But if we don't get that percent positivity rate down, we're not going to stop the spread.
Any other questions for Dr. Dart?
Yes, Dr. Dart, you also talked a little bit about Mayor Bynum just referenced to how he's not really, there are more things that they can do, but what is your suggestion? I mean, is it time for us to limit large events? I mean, we heard City Councilor Lakin last week talking with, giving an update to the planning committee about the fact that permits are still being permitted. Now, granted, they have to have a long list of things that they're meeting for socially distancing and all of those things. But if we're telling families that they shouldn't be meeting for Thanksgiving in their own home with more than 10 people, or even less than 10 people, if anybody's vulnerable, is it fair to say that we can still have gatherings that are large in Tulsa as long as they're meeting all these expectations? Because, frankly, that's mixed messaging for folks listening at home. So can you help us understand?
No, I completely agree, and so we're having those conversations now as well, and hope we talk to the mayor more about that as this week goes on. I mean, you're absolutely right. It doesn't matter if it's a large public gathering, a private gathering in your home. Those gatherings are contributing to what we're seeing now. So we have to, I think, step back and pivot and look at what's changing some of our recommendations to hopefully stop some of the gatherings, lower those numbers, and at the same time see a decrease in spread. So you make a great point. You're absolutely right on, and we are having those conversations as we speak, and Mayor Bynum and I will be talking more about that, because we have to review what really is safe and what really isn't. And I don't want to mix message the public, and I want to have everyone have the same level of accountability, whether they're a private citizen or we're part of a local government. So.
Oh, there it is. Are you still having problems of people refusing to cooperate with your contact tracers, and how much is that impacting our ability to respond?
You know, and trying to use the correct terminology, I'm not sure if it's just refusing to give them information or they're just tired of COVID. But yes, we are having problems gathering the information we truly need to look at what the true exposures events are. So we have stood up on October 19th, I think I told before, a digital contact tracing platform. That seems to be, it's a little too soon to tell, but we seem to be getting a little bit better response to that, because it's not some faceless voice on the phone. It's not a 40-minute phone conversation. People can fill out forms at their own time and get it back to us. So we are seeing more people respond to that. It's still way too low, and we're hoping that will pick up and we'll start to see a better response.
Dr. Dart, is it safe for Tulsa Public Schools to go back to in-person learning with the precautions that they are putting into place?
You know, so far we've actually, the schools have done a really good job in the classroom, especially in the elementary ages. They've been following the recommendations. They've been keeping their kids safe. They've been keeping them distanced and masked. We start to see issues as kids get a little bit older. We go into middle school and high school, and frankly, we're associating that more with extracurricular activities like sports, cheerleading, band, choir, those kind of things, as opposed to exposure in the classroom. So, I think where the schools are struggling is that when they have staff who get exposed, they have to quarantine, and then they don't have the ability to continue their infrastructure is basically wiped out, and they can't do in-class schooling. So we need to continue to watch those numbers, but right now it's not the in-classroom setting that's been our biggest concern. Of course, with this virus, as we know, things change very rapidly, and you give this virus just one tiny opening, and it's going to take it. It's so opportunistic. So while it's safe today, if we don't continue to be vigilant, it won't be safe tomorrow. I mean, that's just the way this virus works.
Last question for Dr. Dart.
Dr. Dart, just can you help us understand, everybody's so excited about the news of the vaccine and the promise that that is offering and a bright spot finally. We heard people say that it could be here as soon as, or available as soon as next month. While we were sitting in here, Dr. Fauci has said realistically that folks should not expect to have it widely available until April at the very earliest. So can you help us get some reality? Because I think people are hearing next month, and then now Dr. Fauci in the last 10 minutes said April is the realistic time frame in terms of widespread distribution.
And so we've been trying to be really clear in our messaging, in that we need to. It's important we hit our priority populations first. You know, our first responders, our healthcare workers, those who are our last line of defense, and of course those in our vulnerable population, long-term care, and those kind of things. So it takes a while to hit those priority populations, and frankly, just to have the numbers of vaccine we need for everyone it takes a while to manufacture that. So we will have the ability to get our most vulnerable and our first responders initially, who should be our number one priority. And then as we're doing that, they're manufacturing. So Dr. Fauci is absolutely right in looking at all the data. We've looked at as well, that we should have volumes by really first quarter, end of first quarter, into the second quarter for public distribution. And I tell you what, we get vaccine for public distribution. It's time to party. We're going to give this stuff out, and we're going to make it available to anybody that wants it, and we're going to make sure that we get this community vaccinated.
Anything else, questions for St. John? Yes? We have first question, Chris.
Sure. We heard yesterday Lieutenant Colonel Matt Stacy in an interim study talk about how he was encouraging hospitals to get away from messaging that he said was scaring people. He wanted more encouraging messaging. Is that something that you're taking into consideration? And I know last week the governor said people were fear-mongering about hospital capacity. Is part of your job to reassure folks right now?
Well, go ahead. Yeah, I mean, I think that realistic and cautious optimism is the way to go. I mean, you cannot divorce yourself from reality, but at the same time, you don't have to have a pessimistic outlook. And, even early on in the pandemic, I had an optimistic outlook, and I continue to do that. Yes, we're going to go through difficulties, but yes, we will find creative solutions. We'll find, people will do extra shifts. I know managers have been doing extra shifts, doing shifts that they didn't do 18 months ago. I've probably taken 20 days off out of the last 7 months. People are doing that. So I think it's possible to have an optimistic outlook. Yes?
I think a lot of people were alarmed to hear about the ICU beds in the Tulsa area when they heard the news last night. Now today we hear you all say, let's be optimistic, we can treat patients when they come. We're repurposing parts of the hospital. And what's it really like? I mean, are there ICU beds or not? Are you having extra rooms that you've made? What's it like? Because to hear that one day and then to kind of hear today that we're able to treat everyone, it's a little bit confusing, and I'm not sure what people are to really believe and understand.
Well, like I told you, it's not that the system is not strained, but I don't think that the system is at a breaking point or a crisis. The reality is we had stood up a unit with, certain number of patients, and there's a certain number of beds, and there's a way to stand up multiple units. There's a way of taking some of the non-critically ill individuals in critical care if the need becomes obvious for a critical patient to go into that bed. So these are kind of the challenges that everybody has faced, and I don't think that, we never came out and said that, we didn't have ICU bed capacity. Nobody asked us about that. So what I'm saying is there are strains that they're going to shift. There will be times when there will be nursing strain. There will be times when a testing reagent is not available, but we will find creative ways. We had run short on swabs. We started splitting the swabs in two and using half the swab for the test, and it worked. It was validated in the laboratory, and it worked. Similarly, you find creative ways of solving the problem at hand. So I don't see that it's a crisis or anything. Like I said, a large number of patients are not requiring ICU beds anymore. That's the other thing. Outcomes have improved. So,
Let me just,
Yeah.
can I just make a couple of comments on the one around the encouraging message, I think, over here. So, the message around our caregivers, we are here to see you all. And, much of this is on the outpatient setting, whether it's at your provider's office or specialist office, an urgent care setting, or if you need us at the hospital, we're available. Capacity does ebb and flow, and capacity is a very fluid thing. Right now we've got 34 available med-surg beds across our organization right now. And when you look at the ICU capacity, although ICU capacity is fairly full, we only have 12 COVID positive patients in the intensive care units right now, and we have some 68 adult ICU beds. So, the community needs to know, and to Dr. Malik's point, it's great news that I think we're getting much better in terms of how we're caring for these patients. Early in the pandemic, I think that we know a lot more than we did early on. And the number of patients that we see in the ICU, what we would refer to internally as seeing in the unit, is much less than what it was early in the pandemic. So I hope it is an encouraging message to the community. Capacity does move up and down. We're currently taking critical care patients that are trauma. We're on trauma today. We're taking trauma patients. We're taking stroke patients, and so that's important that the community understand that and knows that. So.
So just to be clear, is your hospital taking all comers? Has there been a point? I mean, we occasionally hear an ER is on divert,
Sure.
but that's usually very brief.
Right.
Have you guys been diverting patients because you don't have the capacity staff to handle them? Because that's what we were hearing last night. Every room's
Right.
full.
Right.
And we hear about
So
patients
I-
going to Oklahoma City, going to Texas.
Right.
We
Right.
get these
And you do on
reports.
occasion hear that, and that you have to transfer a patient out of state. But even prior to the pandemic, if we don't have the service available here in our community, we may have to transfer a patient to Oklahoma City. Or if we don't have the neurovascular surgeon available, they may have to be transferred out of state. That on occasion does happen. It's very, 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 very limited. But to your question of are we taking all comers, anybody that presents in our emergency department that meets admission criteria, we're going to bring them in. We're going to find a place for them. And like Dr. Malik was saying earlier, we will we'll find the place to place the patient. More importantly, is the staff that's caring for that patient. I mean, we can create an intensive level of care, an ICU level type of bed. It doesn't necessarily have to be inside the unit. It can be inside an emergency room itself for a short period of time, as long as we've got the staff that can move and can flow with that patient. And so, if they meet criteria, they're coming in. And like I said today, we're not turning trauma away. We're not turning stroke away or anything like that. And so the last thing I would say about there are times when you look at the data and you go, wow, every critical care bed in the city is full. I will tell you that you roll this back even before the pandemic. On occasion, we will have that happen in high flu season, in high trauma days, those sorts of things. All the critical care beds will be full across the city, but 2 hours, 3 hours later, as folks move around, a bed will come available, and that's the point in terms of the fluidity of the situation.
I do, yeah. Well, I think to Emery's point, though, I mean, so what you are saying is that there is capacity, but at any given time, because respectfully, we are hearing from family members, and it's not as rare as what you are telling us. I mean, I heard from 3 people this weekend that had loved ones going to other states. So, and that was before yesterday. So I guess, respectfully, is it just that, yes, there is capacity, but at any time, somebody, if there isn't, could be sent out of state?
Sure.
Because I think people at home, and quite frankly, all of us, are
Right.
trying to understand, like Tim
Right.
was saying, like,
Right.
what is it?
Right. Well, I will tell you, it would certainly depend on the urgency of the patient. So if I say today, all 68 of our adult ICU beds have a patient in them, right? And if we're holding a number of patients in our emergency department that are of critical care nature, and we've got all the staff that are being utilized, there could, if the patient is absolutely urgent, we're going to find the right place for them to go. And so I don't know if your transfers out of state were here out of the Tulsa community or if they're out of Oklahoma City, you know, that sort of thing. But hopefully that's very few and far between that happens.
Thanks, all right, we're running low on time. Any other questions for Shelley?
Ask Dr. Malik something really quickly.
Yeah, last question.
Dr. Malik, just thank you for everything you're doing, first of all. I also want to tell you that everybody on social media right now really loves you. You're the favorite of the press conference.
Well, maybe I'll find a second career.
By miles,
Yeah.
yes, by
Yeah.
miles. So
Yeah.
thank you for everything you're doing. We, all of us and everybody in our
I appreciate it. Thank you. It really is a privilege.
Well, we appreciate your good attitude. Can you, obviously not as a representative of St. John's, but just as a doctor who has treated over 500 COVID patients, I just need to ask you, because yesterday I spent 12 hours at the Capitol listening to testimony, talking with our state epidemiologist, talking with Commissioner Fry, and I was told that a mask mandate is a political thing. I was told that we don't need a mask mandate. I was told that people won't wear a mask because they're going to be defiant. And then today I interviewed a Harvard epidemiologist, and I felt like I was in Alice in Wonderland. It's completely a different story. And frankly, every epidemiologist I've talked to outside of this state has told me a vastly different story than anything I've heard in this state, which is sad to me because it makes me just feel like I need to work that much harder to figure out what I need to find out, the truth, to share with our viewers right now at a critical time. How does it make you feel? You've treated 500 patients. I know that from talking to the respiratory therapists on your team 2 weeks ago and talking with you, it's exhausting. What you all are doing, working these shifts, I mean, we appreciate that you've only taken 20 days off in 9 months. However, that sounds exhausting. I mean, how does it make you feel when you hear this, people saying, like, we still don't need a mask mandate? As Mayor Bynum said, it seems ridiculous. How does that make you feel and your team?
Well, you know, going to the scientific question, I think that if you're running in a park and it's sunny outside and windy, I don't think a mask is going to do you or anybody else too much good. But you go into Walgreens and you don't have your mask on, and there's, you know, of the 20 people that are in the Walgreens, you know, 7 or 8 are coming and going, and one of them actually has a sniffle, you know, and they are not wearing a mask. That's a problem. That is where you run into issues, is anybody who is asymptomatic. That's the problem with this disease, that for 48 to 72 hours before you really realize that anything is going on, you've been shedding this virus, and that's, you know, and then some people are very efficient at shedding a lot of virus for a long period of time. They're called super spreaders. It's estimated that 10% of individuals infected account for 80% of the infections. And so, God forbid, if you're a super spreader, you are asymptomatic, and you're in your Walgreens locally not wearing a mask, you're doing a disservice to a lot of people. Some of those poor individuals are going to end up in the intensive care unit. Some of them are going to die. That, I think, is a travesty. You know, what we need to do is, the mask is not going to protect you very much personally. It might do 25%, 40%. Those are the estimates out there, right? But what it can do is it's going to block all the secretions that you're going to throw out. It's going to block them, just physically impact them. When they physically impact, they don't go into the air and hang out as aerosols. It's the aerosols that are responsible for transmission. It's not just coughing on someone, but when you cough, these things get suspended in the air. Water evaporates and they become tinier and tinier. And when they do that, that's when surrounding people get infected and you get a super spreader event. So please, when you're around individuals, you have to be mindful of wearing a mask. So if you're in a store, you go to Reese's, you go wherever you go, even if you're walking outside of your Starbucks where there's 20 people sitting having coffee, you know, there is a certain risk. So, you know, if you're on a trail in Turkey Mountain, you know, that's different. But if you're around other human beings, I think it's not only considerate, but I think it's almost like dangerous for you not to not to wear a mask.
Thank you, sir. Thank you. Okay, questions for Arna Morris? Okay, for Mayor Bynum? Yep. Mayor.
Mayor Bynum, I have two. I'll ask just while I have the microphone. So you told that story about the city employee with 106-degree fever who couldn't get admitted into a hospital, which seems like a little bit of a conflicting message from what we're hearing, that anyone who needs care can get care. You shouldn't avoid hospitals. So I'm wondering if you could just kind of talk more about that kind of dichotomy. Also, your statement and what you said today about politically convenient speeches about personal responsibility. The governor gave a politically convenient speech about personal responsibility today. How does that make you feel at this point in the pandemic?
So first on the incident of our city employee who had a nearly 106-degree sustained fever, he received fluids from one of the hospitals that he went to and then was sent home, and the hospital checked in on him at his home periodically. And I think that's one of the ways, to Dr. Malik's point, that they can provide service while not necessarily having ICU bed capacity. So they can still treat someone. My point with that is not that they just didn't get any treatment. It's that it was on them and their family to take care of them at home. They didn't get to go be in a hospital bed with the best medical care that this state has to offer. They were at home on their own. And that is the reality for folks unless you meet that certain threshold, at which point the hospital feels that your respiratory condition is bad enough that it merits admission. As far as the issue that I have with speeches about freedom and personal responsibility, as I mentioned a moment ago, literally every single ordinance that we have in the city of Tulsa, we shouldn't have to have. All of those things should be things that people do based on their own personal responsibility. But unfortunately, they're not. And a lot of those things, we have them in place because when people don't do those things, other people die. And I think Dr. Malik's point just a moment ago is so important. The purpose of wearing the mask is not to protect you as much as it is to protect other people from you if you have the virus and don't realize it. I'll share a personal story on that. I went to Officer Zarkishan's return to Tulsa. I walked into that event, had a lengthy conversation with Officer Lindsay, then walked out of that event with Officer Lindsay and had a lengthy conversation with him. Both of us were wearing masks. We now believe that at that point he was asymptomatic and contagious. And yet I got nothing. Why? Because he bothered to put a mask on. Him wearing that mask saved me from getting that virus. There are so many other people that could do that for people in this community. You don't have to wait until you're in the full throes of the virus. He didn't know he had it at the time, or he wouldn't have been at that event. So my hope is, again, if people have a really great policy reason for not having a mask ordinance or order in place, I'm all ears. I just haven't heard it yet. The only response I've heard is that it's really hard politically. And that's not a good answer when lives are at stake.
Any other questions for Mayor Bynum? Okay.
Mayor
Okay.
Bynum, yeah, I do. I just was waiting. Mayor Bynum, to your point about that, I feel like, I don't know if you've ever seen that GIF with the little girl whose hair is like all frazzled and she's like falling on the table. Well, that
girl?
one
Yeah.
with the ponytail, but
Yes.
but I don't feel like that anymore. I'm past her. I feel like the girl with the frazzled hair is like falling over on the table. It has felt like that for a while, and truthfully, it feels like we're back to like the March feeling and April feeling of like it's changing so quickly. Things are changing really fast. Is it exhausting for you? I mean, you're yesterday listening, or you heard about the state leaders telling us what they did yesterday. I mean, is that just exhausting? How are we dealing with this? How is this even a thing where we feel like we're in the twilight zone and there's such mixed messaging? A Harvard doctor told me today that, I mean, we're disservicing all Oklahomans by the complete lack of a unified message and by the fact that people are confused about what is actually happening and what they need to do to help that. Is that exhausting for you? You've been standing up here. We still have Broken Arrow that has double the amount of cases that we do in Tulsa, who refuses to have a mask mandate. Other suburbs, like you said, Mayor Lee is taking it to the council tonight. But, I mean, how are you not just ready to be Grouchy 101?
Well, in case you can't tell, I am Grouchy 101 today, if that hasn't come through in this briefing. And I realize I forgot to address the final part of Chris's question, which is related to yours as well. I was talking with my colleagues on the council earlier today, and I told them it feels like we're on an island here. That the people that are willing to take action on this are in our city government, on our city council, and in our mayor's office. And yet, where the issue is, where 61.4% of hospitalized patients are, is not in our jurisdiction and is not in an area where we can impact. And yet, in the places where we need that help, it's not coming yet. My hope is, to the point about optimism, my hope is that yesterday was a wake-up call. The hospital capacity in Tulsa is not important just to Tulsans. It's important to everybody in this part of the state as far as their ability to access first-class medical assistance. I'm encouraged by somebody like Mayor Lee, who is trying to get it done in Jinx. I'm encouraged by the questions I'm getting from colleagues in other cities who see that it needs to be done, but feel that they need to build the political will to do that and need the data, which the health department is going to be providing them to make that argument. But one of the things I love about Oklahoma and that I love about Tulsa is it's ingrained in our DNA through centuries of being in Tornado Alley and being reliant on a boom and bust industry and being in a city next to a river that floods and getting hit with ice storms, that we help each other out. That's why we're America's most generous city. That's why that's not a surprise when we get called that. Because you don't thrive and endure over a century through that kind of environment. Being a city founded by Native Americans who were driven out of their homeland and didn't give up but built a city instead, we thrive over time because we're a community that helps each other. And yet here we are right now, our neighbors need our help. Throughout this whole part of the state, they need our help. And it requires the political courage of people to do that for them, whether that is at the city level or the state level. And I told the governor's office this today, and I've told my colleagues in our other cities, we need their help. We cannot do it alone in Tulsa.
What did the governor's office say to you? I mean, we heard from them for more than an hour, as well as multiple health officials from Integris and OU Med talking about the dire need for everyone to wear a mask right now. What did the governor's office say to you? I'm just curious because we did not obviously hear about a mask mandate.
They're continuing to evaluate the situation, and I don't want to speak for them. They can speak for themselves.
Last question for Mayor Bynum. Okay.
Okay.
Okay, real quick, Emery, did you have RMRS questions? Okay, all right, thank you, everyone.
Thank you.